Hi, I'm Dr. Greg Castello, board-certified family practice, and today we're going to talk about breast cancer, the BRCA gene, and Angelina Jolie. There's been a lot of news in the press in the last few days about Angelina Jolie and her being high risk for breast cancer and having elective bilateral mastectomies to take off normal breast tissue to decrease her risks of developing breast cancer. Where the story starts is that certain people, based on their family history, are at a greater risk of breast cancer, and her mother had breast cancer. So she had a blood test called the BRCA test. So BRCA 1 and 2, BRCA, breast cancer 1, and BRCA 2. And this tests for a group of genetic mutations where you are at a greater risk of developing breast or ovarian cancer. Your body has proteins that prevent or protect you from developing breast and ovarian cancer. These proteins go out and they monitor your DNA for broken pieces or abnormal pieces of DNA, and they actually repair and destroy the damaged DNA before they have a chance to become malignant or cancerous. If you have an abnormality in one of these proteins, or a BRCA1 or BRCA2 abnormality, then there's a greater chance of you developing cancer. So the BRCA1 abnormality that Angelina Jolie had put her at about an 80% lifetime risk of developing breast cancer, so she had both of her breasts removed to decrease the chances of this. This blood test is available. It is expensive and done through your doctor, and is absolutely not recommended for the average population, only if you are at a high risk of developing breast cancer in the first place. So if you've had breast cancer yourself at age less than 50 or premenopausal breast cancer, if you've had two separate breast cancers, not one that has come back, but two separate breast cancers, if you've had breast cancer and ovarian cancer, or if you've had a family member who's had any of those types of cancers, you should have the test. If you've had a male family member who's had a breast cancer, you're also at a greater risk. If you've had multiple family members that have had either breast or ovarian cancer, you're also at a greater risk, and might be a good idea for you to get this blood test. There's several different abnormalities that are identifiable, and there are more coming every day. And if you have one of these abnormalities, you need to speak to either an oncologist or a geneticist, because the different risks are different percentages. So if you have a certain abnormality, you could be as high as 80% for developing breast cancer, or as high as 50% for developing ovarian cancer. There are other genetic abnormalities that carry a much lower risk of developing cancer. There are several different treatment options if you have one of these BRCA abnormalities. Something as simple as just being in a high-risk group. You should have a doctor breast exam twice a year. You should do your monthly self-breast exam. You should be sure to have annual mammograms and probably annual breast MRIs as well. More radical things you could do would be to have an elective or prophylactic bilateral mastectomy. They do skin-saving and nipple-saving mastectomies, where they take out your breast tissue, the majority of it, and leave your skin and nipple intact, and then put a prosthesis in under the skin to rebuild the breast. This is not curative, because they do leave about 5% of breast tissue behind, which could become cancerous. And even with a radical mastectomy for cancer, they actually leave a little bit of tissue behind and can have a local recurrence of breast cancer. You can have an oophorectomy, or have your ovaries and fallopian tubes taken out if you are premenopausal. So Angelina Jolie could have left her breast tissue and had her ovaries taken out, and that would have decreased her chances by about 50%. So she would have gone from an 80 to a 40% risk of cancer, which in her case is still quite high. You can do the combination of taking your ovaries and fallopian tubes as well as your breast, which would be the greatest reduction in your overall lifetime risk, down to about a 5 or 10% risk. There are some medications you can do, such as tamoxifen, which is used in certain types of breast cancer that are stimulated by estrogen. The tamoxifen blocks the estrogen and lowers the stimulation of tissues and decreases your risk, both in women who have had breast cancer as well as women who have not but have this BRCA gene abnormality. There's a medication called Evista, which is a SERM, selective estrogen receptor modulator, and this medication has actually been used for quite a while in postmenopausal women in place of estrogen. It's also used for osteoporosis. And what this medicine does is it looks very similar to estrogen. It sits in your estrogen receptors and keeps them busy. So if you have, say, breast tissue and have estrogen receptors that estrogen might go to and stimulate the breast tissue to grow, if this Evista medication is sitting in the receptor, even if you have normal estrogen levels, the estrogen is relatively blocked, and it decreases the stimulation or effect of estrogen. So just as a summary, Not everyone should go out and have this BRCA test. It is very expensive. There is a list of things that would put you in the high risk group, and we talked about several of those, so you can go through those with your doctor, and if they determine that you are high risk, you probably should have this BRCA test. There are multiple variations in the BRCA genes, so they do not all carry an 80% risk of breast cancer. Many are lower, and some carry a higher ovarian cancer risk. We do not know all of the different genetic mutations. So 5 years ago, you could have had the BRCA test and was told that you were negative or normal, and then had the blood test again now. And since we have identified some newer abnormalities that are on the test, that you could have had an abnormality. So having a normal test does not absolutely infer that you will be healthy and safe, and you probably should go back to your family history, which would put you at a greater risk regardless if you've had this test. Also remember that breast cancer, although we see it on TV and fundraisers and bumper stickers, is only about a 1 in 11 lifetime risk of developing breast cancer, lesser chance of dying of it. Both men and women actually have a 1 in 3, or about a 33% chance of developing and dying from heart disease and stroke. So although breast cancer is important, you have at least a 3 times greater chance of developing heart disease and stroke, and a much higher chance of actually dying from those diseases. So don't stop and forget about the common sense things like diet and exercise and low fat and weight loss and taking your medications like your doctor recommends. Be healthy. Dr. Greg Castello. Thanks.